PCI, medicine is safe. The number of patients is only one. Based on my dispatch information, the nature of illness is a possible stroke. I am going to request an ELS ambulance immediately. At this moment, I won't hold his spine. My general impression is that I have a male patient sitting on a chair and he seems not feeling well. Hi sir, my name is Gabriela. I'm with the ambulance service. What's your name?
Us.
Mr. Haas, I want to ask you some questions in order for me to help you more effectively. So please bear with me. I will take care of you well. Do you know where you are right now?
I'm in my apartment.
Do you know which day of the week is today?
It's Wednesday.
Now, can you tell me why did you call us? What's going on with you today?
Well, first I got a terrible headache, and then the whole right side of my body was tingling, and now it's just totally numb.
The patient is alert and oriented times 4, and I don't. His chief complaint is a severe headache, and the right side of his body is tingling and numb. And I don't see any apparent life threats, and I don't see any external bleeding, so I will continue with my ABC. For the patient has his airway open because he is talking to me. So now I will take his radial pulse and his breathing rate simultaneously for 1 minute. The radial pulse of the patient is 110 beats per minute and regular, and his breath is 28 breaths per minute and partially shallow, which is inadequate. So I will assist his breathing with high flow oxygen through a non-rebreathing mask at 15 liters per minute. Now I am going to feel his skin for temperature. The patient is warm and dry to the touch, and his skin looks pink. At this moment, I don't see any signs of shock. I don't see any external bleeding yet. The patient is a priority transport, so I will do that as soon as possible. Now I will continue with my history taking. Sir, did this pain began gradually or all of a sudden?
It was gradually.
Okay, does anything make it feel better?
No.
Can you describe your pain, please?
Well, I just have a crushing headache. And then the right side of my body, first it was just a little tingly, and now it's just numb.
Now, being 10 the worst pain you ever felt in your life, can you tell me between 1 and 10 was the
It's
number
a 10. I've never felt anything like this. It hurts so bad.
Now, can you tell me what time this began?
I don't know, maybe about half an hour ago.
Okay. Now I will continue with sample. Have you had any signs or symptoms of suddenly weakness?
No.
What about nausea?
No.
What about any headaches or any stomach ache?
No.
Have you fallen in the last 6 months?
No.
Have you been doing any strenuous exercise that could have hurt your body?
Well, I was doing some burpees earlier.
Okay. What about have you bumped your head?
No.
Into anything? No. What about diabetes? Do you have diabetes issues?
No.
Do you have allergies?
No.
Okay. Do you take any medications?
No.
Okay. What about and then?
Oh, well, I have high blood pressure.
So you take
So
medication.
I take medication for the high blood pressure.
Okay. What about any past major illness? Have you had any issues, surgeries, or or strokes or anything?
No.
No? Just this hypertension, just this high blood
Yeah,
pressure?
just my high blood pressure.
Okay, when was your last what was your last meal?
It was like lunchtime.
What
A
did you
few
have?
hours ago I had beans and rice.
Okay. Can you tell me how this began, how all this pain, when all this happened?
Well, I had a fight with my girlfriend,
Uh-huh.
and then a little while after that, I just got a real bad headache, and then, like I said, my right side went numb, and then was tingly, and then it became numb.
Okay, now can you please, now I will begin with my secondary assessment. Can you smile for me, please? Now can you stick your jaw out and then can you move it side to side, please? Can you open and stick your tongue? Okay, now I'm going to help you lifting your hands up to see what's going on. I will take note that the right hand drifted, so his right side might be having an issue like heat flame. Now I will check his eyes. Pupils are round, reactive to light, bilaterally. Now I will feel his chest to see anything. Do you feel any pain?
No.
No? Can you take a big breath for me, please? Does it hurt?
No.
Okay, now please can you grab my fingers? In this hand you cannot. Grab your fingers. Okay, I will take note that his right hand is couldn't grab my finger. Now can you wiggle your hands, please? Or again, the right hand is not working. Now can you tell me which finger I am touching right now?
Well, on the left hand, it's the middle finger.
In the right hand?
I can't feel it.
Yeah, he's having problem with the right hand. Now I'm gonna do the feet to see the circulation. And okay. Can you please press your feet against me, please? Yeah, the right feet is also not working properly. Can you really your feet toes? Yeah, only the right feet can do that. Do you know which finger I'm touching now?
Well, I can feel this one is the second. I can see this is the second, but I can't feel it.
Okay. Now I'm going to touch his abdomen to see any problems. Does it hurt anywhere? Does it hurt?
No.
No? The patient, my general impression is that we are leading with a neurological issue event here, perhaps in transient ischemic attack, but the patient is having problems in the right side of his body, which could escalate. So now I'm going to take his blood pressure.
You're really a nice person.
Thank you. Is that okay? It's not hurting you?
No.
Okay. Thank you for being cooperative.
taken?
His blood pressure is 188 over 12. Now I will take his pulse bilaterally one more time. His radial pulse bilaterally is 102 now, and his breathing rate. His breathing rate now is 26 breaths per minute. At this point, the patient needs to be transferred immediately. I'm not going to do any psychologically or reproductive assessment. I don't think so is needed. So I will contact the medical order so they can allow me to administer the patient with some aspirin, no more than 324 milligrams, and that's gonna be all. Now I will reassess the patient every 5 minutes, and then after that, especially his blood pressure, and then I am going to be on my way. I'm gonna call. I'm gonna give my report, and the first thing I'm gonna say is that identify my unit, then the estimated time of arrival. I have a 43 years old male patient here complaining of a severe headache, and the right side of his body is having difficulties, and he's alert and oriented, hands 4. And his pressing illness is just perhaps a neurological problem, transient ischemic attack, and he doesn't have any past major illness. I already administered some aspirin, and the patient the pain went down. At this moment, I will ask if medical orders have any questions or any orders, and I am done with this station.